Many a times women come to our OPD and say that they bleed only for a day. Sometimes they feel that though the bleeding continued for 5 days, but it was merely spotting. Scanty periods is what generally bothers them a lot. So hello friends, I am Dr. Prachi Benara, Senior Consultant, Gynecologist and Fertility Specialist, Gurgaon. The flow during periods typically lasts for 2 to 6 days. And generally a woman uses 10 to 12 sanitary towels during this duration. Anything less than this is generally called scanty periods, which affects almost 15% women. Scanty periods is not always dangerous. Nothing accumulates inside our body. There is nothing dirty that is accumulating inside our body which can lead to further problems. But yes, there can be certain hormonal or other issues which needs to be tackled. Let's understand what are the reasons of scanty periods. Scanty periods can be hormonal or they can be due to certain pathological conditions of the womb and sometimes can be simply due to deficiency of blood or anemia. Now first let's understand how does a woman bleed. When does a woman get her periods? So every month, nature prepares our body for a pregnancy. In the first half of the cycle, the endometrium generally builds up under the influence of estrogen hormone. In the second half of the cycle, there are secretory changes in this endometrium, which is in preparation to a pregnancy. But if no pregnancy occurs, this endometrial lining sheds and this is how we get our periods. Now let's understand what can be the hormonal causes. Any change in balance of estrogen and progesterone can lead to scanty periods. This can happen due to certain genetic factors like my mother had scanty periods, sister had scanty periods, so the woman also suffers from scanty periods. It can be certain disorders like PCOS or PCOD, which can lead to abnormal balance of estrogen and progesterone, leading to scanty periods. Sometimes very high levels of prolactin or abnormal levels of thyroid hormone can also lead to scanty periods. So, it is important to test yourself for these hormones in case you are suffering from scanty periods. Let's talk about the pathological causes of scanty periods. So, any problem which disrupts the lining of our womb, disrupts the endometrium, can lead to scanty periods. Typical situation called Asherman syndrome, in which due to repeated DNCs, the basal layer of the endometrium, which is responsible for endometrial proliferation or growth of the endometrium, is disturbed or disrupted, which can lead to thin endometrial lining. It can also lead to certain adhesions in the womb or the endometrial tissue and therefore preventing the full flow of endometrium during periods. Asherman syndrome is an important problem which needs to be diagnosed with the help of a 3D ultrasound. Sometimes a camera test called hysteroscopy, which is a type of endoscopy, is also required to diagnose Asherman syndrome. Second very common condition in Indian subcontinent is genital tuberculosis, that is TB of the uterus, which can also lead to scanty periods. It is very easy to diagnose tuberculosis. When you are bleeding, a tissue from the endometrium is collected by endometrial biopsy and sent for testing for tuberculosis bacteria. Sometimes too much stress, which can be mental fatigue or physical stress, can also lead to scanty periods. Sometimes losing weight very fast, sudden reduction of weight can also lead to scanty periods because the fat cells in our body store estrogen, and in case they are depleted, the estrogen stimulating growth of the endometrial lining becomes less, which can lead to scanty periods. A simple form of contraception called oral contraceptive pills or Contraceptive devices inside the uterus like Mirena or copper T also leads to scanty periods. But whenever we stop using such contraceptive pills, the periods return back to normal. So if you are suffering from scanty periods, visit a gynecologist. There are important blood tests to be done which can understand your hormonal balance and also understand the hemoglobin content of your body. Sometimes you'll be advised to undergo a simple ultrasound to understand the presence of any pathological conditions. Scanty periods is a very much treatable problem. Please visit a gynecologist in time if you are suffering from this problem. Thank you.